This podcast represents a brief history of the law relating to the issues raised. This should not be relied on as a substitute for professional advice. Specific legal advice should always be sought in relation to any particular circumstances, and no liability will be accepted for any losses incurred as a result of reliance on this podcast by those relying solely on this podcast. Welcome now to Hicksons Health Hour, the podcast series that explores a variety of current legal health topics. Throughout each episode, hear from different members of our health team with expertise in the area. We begin our discussion today with some background on the controversial prescription of medical cannabis. Many would agree it has benefits for pain control and the like, but can be challenging for medical practitioners, especially in the treatment of those who are cannabis dependent. So when was medical cannabis first legalised?
So, medicinal cannabis was legalised in 2016 in the state of Victoria, and then it kind of led to a domino effect, and with every other state legalising it thereafter. So, while medicinal cannabis is identical to recreational cannabis in its elemental form, it's actually used for a different purpose, the purpose of therapy and relief. Now, irrespective of the regulatory frameworks for medicinal cannabis, there are concerns regarding compliance with regulatory frameworks, commercial arrangements between healthcare practitioners for financial incentives, and this has an adverse impact on patients. Healthcare practitioners are encouraged to consider the multitude of factors prior to prescribing and even considering medicinal cannabis for treatment.
My name is Stojkova, and I'm Special Counsel in the health team.
And I'm Chantelle Kaur, and I am a solicitor in the health team. The second on the hierarchy is the Therapeutic Goods Administration, also known as the TGA. So the TGA regulates access to therapeutic goods and the quality of those therapeutic goods in Australia. In order for a therapeutic good to be lawfully supplied, it has to be entered on the Australian Register of Therapeutic Goods, unless of course there's an exemption, and these exemptions are under Schedule 8 of the TGA, but we'll discuss that later on. Now, at the bottom of this hierarchy is the State and Territory Departmental Legislative Framework. So this is basically the poisons legislation and drug misuse legislation.
But medicinal cannabis is not on the Australian Register of Therapeutic Goods, so how, therefore, is it accessible to people?
Medicinal cannabis is an approved therapeutic good. So the TGA provides access to it through exemptions, and these are under the Authorised Prescriber Scheme, the Special Access Scheme, and clinical trials. Now, with the first one that I mentioned, Special Access, this scheme, SAS for short, allows healthcare practitioners to apply for an individual patient's access to medicinal cannabis. Now, the second one, the Authorised Prescriber Scheme, this actually allows practitioners to prescribe medicinal cannabis to multiple patients. But in order for you to become an authorised practitioner, you actually need to be licensed or registered under the Australian Health Practitioner Regulation Authority. In addition to this, you actually need approval from the Human Research Ethic Committee or an endorsement from an appropriate specialist college. Authorised practitioners also have an obligation to provide 6 monthly reports for patients that they are treating with medicinal cannabis, or, whatever period that they're prescribing them medicinal cannabis for. And the third one, of course, is clinical trials.
There are multiple concerns regarding the prescription of medicinal cannabis, and it's essential for healthcare practitioners to consider a number of factors when prescribing. What are the pertinent questions that should be asked?
Well, this is my favorite question. There are actually a couple of factors, so I'll give you the first one. You need to consider if you've conducted an adequate assessment of your patient prior to prescribing the medicinal cannabis. Now, it's an unauthorized good, which means that there's significant attention that must be paid to when prescribing it to patients. As a healthcare practitioner, you have the responsibility to consider your patient's needs, any contradictions, their medical history, and basically the risk of them becoming dependent on that medicinal cannabis. For example, let's say you have a young patient and they have a history of psychosis. Now, they would be at a very high risk of becoming dependent to medicinal cannabis. Now, On the other side, let's say we have a middle-aged woman with no history of dependence and no history of substance abuse in her family. She would be less likely to become substance or dependent on cannabis. Now, the second thing that I would like you to consider is whether there are any contradictions. Now, what I mean by this is, let's say that your patient has a respiratory disease. Now, if you prescribe them with medicinal cannabis that requires inhaling, well, that's a bit of a contradiction. That's really not going to work for their health. In fact, you would have to consider an alternative, such as gel, if they're suffering from chronic pain. And thirdly, the next consideration that you need to make is whether the medicinal cannabis you're prescribing is actually providing them any treatment. Now, if the purpose of it is to provide your patient with relief, let's say they have really bad chronic pain and they're getting no relief out of it, you need to consider whether they're just taking it out of the hope of relief or if they've become dependent and you're just prescribing it now. And the last consideration that I'd like for you to take is if you're actually monitoring your patients while you're prescribing them. So a lot of patients can just mysteriously lose their prescription and request a higher dosage or even shop around for other doctors. As the prescribing doctor, you actually have an obligation to track your patient, their symptoms, and any impairments that could occur whilst they're on medicinal cannabis. And Category C, which refers to whether the product is on the TGA's established history of use.
But some patients, of course, will be drug dependent. So in those circumstances, what factors should practitioners consider?
When prescribing medicinal cannabis to someone that is or was drug dependent, you have to consider these things. Now, the first one is, are they going to have difficulty controlling the usage of cannabis? And you can do this by determining how long they're going to use and if they're refusing to cut down. The second one is, will it impair their health, their social functioning, or their relationships? And the third factor you need to consider is, will they have any physical issues from dependence, such as issues to their health, their driving, or just tolerance in general? If you still believe that medicinal cannabis is appropriate, then you need a permit, which you can access through the TGA's Medicinal Cannabis Special Access Scheme portal.
What is a healthcare practitioner's exposure on liability?
Healthcare practitioners take on liability when they prescribe medicinal cannabis. Now, it's important to bear in mind that you could face disciplinary action under the Health Practitioner Regulation national law should you fail to meet the therapeutic standard of what is appropriate in the circumstances. Now, the disciplinary action involves an investigation process which is undertaken by the Healthcare Complaints Commission, where immediate action could be taken against the practitioner by suspending or even imposing conditions on their registration. The New South Wales Ministry of Health may also take action by prohibiting or restricting a person from holding any authority to prescribe, possess, or even supply a drug of addiction. Further, the patient may also have the opportunity to commence civil action under Section 50 of the Civil Liability Act. This is on the basis that you may be found to have failed to meet the standard of care that's expected of a professional.
What steps can one take to try and safeguard against liability?
Well, realistically, if someone wants to sue you, they will. Although there are still things that you can do to achieve best practice. The first thing you can do is make sure that you're aware of the current regulatory requirements. The second is, consider the history of conduct and clinical assessments of your patient. Are they being supplied by any other medication under Schedule 8? The third is, obtain written informed consent. The fourth thing you can do is make sure you abide by APRA's Code of Conduct, which can be found online. The fifth is, you need to ensure that you don't enter into arrangements which are to do with the exclusive supply of medicinal cannabis with a prescriber or a third-party provider. The sixth is to conduct an independent clinical assessment for every prescription because, as we know, patients can become drug dependent. The seventh is to ensure that your patient's dosage is within the medicine prescribed or supplied in accordance to the TGA's standards. And most importantly, do not become incited by financial gain.
Well, While there is little you can do to prevent being sued as a healthcare professional, there are resources and standards that allow you to ensure that you safeguard yourself when prescribing medicinal cannabis. In addition, the Australian Medicinal Cannabis Association allows practitioners to stay up to date with changes and provides direction for practitioners that are considering medicinal cannabis for their patients.